My adjournment matter is for the Minister for Mental Health, and the action I seek is for the Minister to provide an update on the work the Victorian Government is doing to support workers across our mental health, social services and community services sector. Deputy Speaker, as the local member for Pascoe Vale, Coburg and Brunswick West, but also as someone who's proudly married to a long-time former community social worker, my wife Anna Owens, who previously worked for the Department of Justice, Corrections Victoria, including Dame Phyllis Women's Prison and the Courts, VACRO, the Victorian Association of Care and Resettlement of Offenders, Child Protection Society and Vincent Care and Glenroy. I'm committed to doing everything I can to continue supporting and advocating for our incredible local health, wellbeing and community social sector worker. Because, Deputy Speaker, I'm so proud to also represent a community that is home to some of the highest proportions of people, namely women, who work in our social services sector, with Marybeck home to 12,800 such workers, making up almost 14% of our local workforce, with many working at Lost Mary Community Health, Vincent Care, Smith Family, Melbourne City Mission, Women's Housing Limited, Mary Outreach Support Services and many other organisations. And in celebration of International Women's Day for 2025, I'd like to thank all of our incredibly hard-working members of these critically important sectors. In doing so, I particularly acknowledge the selfless members of the Health and Community Services Union, HACSU, who every single day help serve and support some of our most vulnerable community members across Victoria. The origins of HACSU can be traced back to April 1911, when it was originally registered as the Hospital and Asylum Attendees Employees Union, and HACSU's continued to evolve ever since, with its commitment to advocating for the rights and wellbeing of healthcare workers always remaining steadfast and unwavering to ensure a strong and united voice for its members. Today, HACSU proudly represents over 12,500 members across mental health, disability, drug and alcohol services through a range of roles such as nurses, allied health professionals, lived experience workers, disability support workers, program support workers, case administration workers and drug, alcohol and other substance support workers across Victoria, including our northern regions here with the member for Broadmeadows. HACSU's members work across the Royal Melbourne Precinct, Austin Health, Northern Health, Headspace, Origin, Western Health, Peninsula Health, Barwon Health, Grampians, Monash Health, Eastern Health, Aruma Disability and Scope Disability. But Speaker, as identified through the landmark Victorian Royal Commission into Victoria's mental health system, we know there's significant more reform required to continue helping our mental health and community workforce, because the facts sadly speak for themselves. 1 in 4 Victorian health community service workers have experienced work-related gendered violence, including sexual harassment. 70% have reported aggression, violence, abuse coming in from patients, with women making up 78% of the Victorian health and disability workforce. We have to do better. In this respect, I do draw the House's attention to Recommendation 16 of the Royal Commission, which found that we need to do more for the Victorian Government to promote good mental health in workplaces, address mental health barriers for good mental health, promote inclusive workplaces that are free from discrimination and stigma, and support industry-based trials that demonstrate safer workplaces. In this regard, HACSU was previously a recipient of the Work Safe, Work Well, Respect funding program. HACSU's Breaking the Silence project is a pioneering initiative designed to confront challenges of gender-based violence and sexual harassment within the disability and mental health sectors. Training around 1,000 disability workers and 600 mental health workers, the program seeks to equip workers with best practice responses to gendered violence and sexual harassment, enhancing the ability to create safer workplace environments. The findings from the work will be shared with WorkSafe and the Victorian community. And as part of recent International Women's Day celebrations, I'd like to acknowledge HACSU's leadership and all of their members, including Deb Gunn, the President, Paul Healy, the State Secretary, Rebecca Sprekos, the Assistant State Secretary, James McWhinney, the Lead Organiser, and Stephanie Thuson, the Government Liaison Officer.